Having a stone was the worst thing in my life. Now I've got some stones in the kidney and my urologist doesn't want to do anything about them. Let's talk about why they don't want to do anything about these stones. Hey guys, Dr. Segla here. So the question is, I want all the stones in my kidney gone, but my urologist won't do anything about them. Why? So let's talk about it. I get that question all the time because patients had a really tough time passing their stone, getting their stone treated, having a stent, all these things, right? It's an uncomfortable thing to go through and it's a difficult thing to go through. And we'll get a scan after the procedure and they'll have some residual stones. And at the end, I'll tell you kind of the number one reason why oftentimes we don't do anything about these stones, at least in my practice and kind of the way we practice things around here. So when we see stones on CT scans or ultrasounds, one of the biggest things that we want to know, and I use this analogy all the time, is the sink and drain analogy for the urinary system. So if you look at the kidney here, right? So what we care mainly about with stones is not necessarily these stones that are floating around in the kidney, all right? That's like the sink, where there may be a pebble floating around the sink. It might be stuck on the wall of the sink, a little calcification per se, but it's not causing any issues. What's problematic is when this calcification now drops into the drain. This stone now drops into the drain, like right here, all right? So instead of having a non-obstructive stone, we have an obstructive stone, and that's a whole different circumstance. But what I'm specifically talking about right now is when we see these types of stones on imaging studies, these non-obstructive stones on imaging studies. If they're not causing an obstruction, then usually there's no back pressure onto the kidney. That back pressure is the thing that's painful with stones. When urine cannot get past that stone, puts pressure on backwards in the kidney, and the nerve endings in the kidney feel it, and it's excruciating. If the stone is not obstructing you, well, there's no back pressure on the kidney, so we aren't as concerned about it. If this stone is a huge stone, that's a different circumstance, and we'll talk about that in other videos, how we deal with something like that. But usually for relatively small, non-obstructive stones in the kidney, they're not causing a back pressure because they're not in the drain of the sink. They're just in the top of the sink. So oftentimes we'll watch them for that reason. You have to remember every procedure that we do, even if it's something as minimally invasive as a shock wave, which is applying shock waves to the stone externally to try to get them to be small fragments, all these carry risk. Applying a shock wave to the stone seems like a no-risk strategy, and it's a very low-risk procedure, to be clear. But there is the potential for bleeding afterwards, causing what we call a hematoma or a blood collection around the kidney, which I've certainly seen. And that's because when you're applying shock waves to the stone, you're also going to apply shock waves to the kidney itself. So if something's not bothersome, then why would you subject somebody to a procedure that can cause a blood collection around the kidney? Now, to be clear, there are circumstances where that's a very reasonable thing to do, and we do that all the time, but we just have to be careful about thinking about whether it's worth doing or not. Also, with a scope procedure, there can be damage to the ureter, scar tissue formation, infection, bleeding, discomfort from the procedure itself. So applying a ureteroscope or putting a scope up here to treat these stones can oftentimes be more problematic for all those potential problems with such a surgery. So those are two reasons why we don't just apply shock waves to them. We don't just go up there with a scope and apply lasers to them, because every procedure that we do carries a risk-benefit analysis, and oftentimes the risk of doing that procedure is higher than the benefit of doing that procedure. The other thing to remember is all these require anesthesia, typically. So a shockwave oftentimes can be done with just some sedation, like a twilight, like you might think of with a colonoscopy. But very frequently, ureteroscopy is with general anesthesia, which carries a risk. So if you have a stone that's not obstructing you in the kidney, not causing any problems, and the only reason people want something done about it is just because they don't like the idea of it's there, Well, that might carry more risk than the risk of anesthesia, general anesthesia with that procedure. So that's another reason why, especially in individuals with other medical problems. One thing that's a little bit subtle is that what's important with stones is when they drop into this area, this brown area here. This is called the collecting system, or the beginning of the sink, that drains into this tube here, the ureter. There can be situations where these calcifications are actually outside the sink. They're in the meat of the kidney. This is called the parenchyma of the kidney, all right, parenchyma. And if it's out there, first of all, we can't access it with a shockwave or a scope, and they're not bothering anything because they don't even have the potential yet of dropping into the drainage system. They're just some calcifications that we see in the parenchyma, or the meat of the kidney. So number one, we can't get to them, and number two, even if we could, it's not going to give you any benefit, even in terms of these stones being able to drop into the ureter, because they're just not in the drainage system at all. So that's one reason why, and we can figure that out sometimes with imaging studies like a CT urogram. We have other videos that describe, that imaging study. And this is the number one reason, kind of my parting shot for one reason why we don't necessarily go after these non-obstructive stones. This is my personal reason, is that we don't want to poke the bear, right? So this is not causing an issue. It's there. We can see it on the CT scan. But when we start applying lasers to it, we start applying shockwaves to it, sometimes a calcification that was nice and happy sitting here, guess what it'll do? It'll fragment, and then it'll start to move. And now we've created a problem, right? So we had a non-obstructive stone that was sitting there, living its life, not bothering anything. And because we messed around with it, we've created some fragments that are going to travel into the ureter and potentially obstruct the ureter. So we're creating a problem where there never was a problem. And that's kind of the number one reason oftentimes we don't do anything about these non-obstructive stones in the kidney. It's kind of like poking the bear, and we prefer not to do that. It's like messing around with your kid when they're hungry. But anyway, I hope that gives you some insight as to how we treat non-obstructive stones, or stones in the kidney that aren't causing any issues, why your urologist may be not too excited about going after these, and why that's oftentimes a very good decision. Certainly very big stones in the kidney and other circumstances, we do treat stones in the kidney. I want to be clear about that. But oftentimes we'll watch them for the reasons that I said. So thank you so much for listening. We certainly appreciate it. Please subscribe to our channel.